As the primary care problem persists in New Jersey, one resolution being considered is a thing called the patient-centered medical home. The New Jersey Healthcare Quality Institute invited Dr. Terry McGeaney to explain this possible solution further at a primary care summit held on May 11th of this year.
The simple way to look at patient-centered medical home is encouraging patients to have a continuous relationship with a personal physician, dealing with their wellness and their illness issues.
The key to helping the patient in this model is to not eliminate specialist care, but to manage it.
There's no question that patients at certain times in their life need a specialist. There's absolutely no question. But very often when they see one specialist, they see many specialists. And so the point of patient-centered medical home is somebody coordinates all that. So that somebody coordinates all the information, coordinates all the care, and makes sure all the people that are involved know what each other's doing. So that's a specialist issue. The other issue is with patient-centered medical home that a large majority of the time patients don't need to see a specialist. But when they do, it's a matter of getting them to the right specialist, and rather than have the patient look up for somebody in the phone book.
Even after the patient has been taken care of, there's still much more to be done in primary care, and it's not all up to the docs.
Primary care practices have to change. They have to become more customer friendly. We have to have more extended hours. We have to have a patient orientation that a lot of primary care clinics do not have right now. But that's just part of the solution. Part of the answers that are coming out of Washington right now are actually to incent patients to do the right thing. Healthcare is really a dynamic dance between the health professions and patients, and ultimately it's got to be a partnership. So we have to incent not just our provider community, but we also have to incent the public to do the right thing.
Our doctors are also getting increasingly frustrated with their patients. I was dealing with our last Surgeon General, Dr. Richard Carmona, who used to work for President Bush, and he said, our doctors in some cases don't feel like doctors. And I said, really, what do they feel like? He said, the doctors feel like they're the repairers of America's social indiscretions. You know, people that eat too much, drink too much, stab each other, take drugs. So a lot of this revolves on the patient also to be, an advocate for their own health.
While doctors may be feeling this frustration, some experts warn a lot of the problems stem from the current system itself.
Before we start asking the questions of whether or not it's the responsibility of the patients, I really think we need to take responsibility as providers and systems of care to make our systems accessible. I mean, we have made a really dysfunctional system that's very hard even for highly literate, highly educated people to access. I mean, you don't have to go long before you hear stories from someone who's had an elderly relative tell you how hard a time they had accessing the system, and those are often educated people who are able to navigate and advocate for themselves. You know, when you've got a population of people who aren't empowered to advocate for themselves, then the system really falls apart.